Hello, everyone. Happy Tuesday. I'm Allison Bond, the Medical Director of Department of Medicine Grand Rounds, and I'm excited to announce who we have for our speaker of the Alice Hamilton Lecture. A little background about this lecture. Each year, our UCSF Division of Occupational, Environmental, and Climate Medicine sponsors a lectureship in honor of Alice Hamilton, who was the founder of the modern discipline of occupational medicine in the U.S. We do have Dr. Robert Harrison here, and I will let Dr. Solomon do the intro.
Thanks, Allison, and welcome everybody to the annual Alice Hamilton Lecture. This is always something we're excited about in our Division of Occupational, Environmental, and Climate Medicine. Alice Hamilton was an activist, and I am proud to say that our faculty member, Dr. Bob Harrison, is also a clinician, scientist, activist who really is always thinking about how to better protect workers. And he is also, in addition to his role for many decades on our faculty here at UCSF, he is also a leader at the California Department of Public Health in the Occupational Health branch. And he has helped shape policy in the state of California on all kinds of issues, you name it: lead poisoning, pesticides, chemicals, heat illness, COVID, other infectious diseases, and many more things. And I'd say if there's a regulatory hearing in California on worker health, there's a reasonable chance you'll find Bob there testifying, or he will have written the report that everybody is citing at that hearing. And so, a few years ago, one of our residents queried an earlier version of ChatGPT about I believe the query was, who are the most prominent occupational medicine physicians? And got the response: Bernardo Ramazzini, the father of occupational medicine, Alice Hamilton, and Bob Harrison. Might have been a hallucination, but I actually don't think so. But I may be biased. And so, I actually think it was kind of appropriate because Ramazzini built the foundation of our field. Alice Hamilton really made it real. She connected with the importance of bringing the science to the policy, and that is really what Bob Harrison has done, is really taken things from the clinic or from the science to the policy arena, which is really important and something that I hope you all take away as a key component of our role as physicians. So, in the fitting company of Alice Hamilton, I am so happy to introduce our good colleague and friend, Bob Harrison.
Thanks, Gina. I didn't know that AI hallucinated until just last month. It was like a total learning for me. Anyway, so it's fabulous to be here. I started 40 years ago across the street. I've been at UCSF my whole career, and that's not a coincidence because I've worked with many of you fabulous colleagues here at UCSF and with the California Department of Public Health. So without you, a lot of this, what I'm going to share with you, could not be done. So I have no relationships to disclose. And this is the Alice Hamilton Lecture, so I would be remiss in not just talking briefly again about Alice Hamilton. She really was the founder of our field of occupational medicine. She was a physician, scientist, and then for me, probably as important, an activist with communities and workers in which she engaged. She was a professor of Harvard, first woman a professor there. She lived over 100 years old. She wrote a couple of incredible textbooks. And she focused on all these occupational toxins, which I have listed here: lead, benzene, mercury, radium, et cetera, which were some of the most dangerous occupational chemicals of her time in the early part of the 1900s. But as important, she wrote and focused and advocated on the connections between work and the social and community and economic life of the communities that she was embedded in, which included child labor, workers' compensation, housing, and work hours that people were working in. She was commissioned by the state of Illinois to write lengthy reports, and she spent several months a year at the Hull House, which was a community activist house in Chicago. It's now a museum. We can visit it, along with her sister and a number of activists. She talked to workers, she talked to community. And that's when I read her writings, that really is what resonates for me personally, that I learned in my career. Tony Mazzocchi came to my medical school class when I was at Albert Einstein in New York City in the fall of 1975. And he was a labor leader. He led the Oil, Chemical, and Atomic Workers Health and Safety Department. And he had the ability to talk to medical students as well as labor union leaders, really using the same vocabulary. And what he said is that healthcare professionals could help workers understand the health effects of toxic chemicals and to change the world and to eliminate those most toxic chemicals. And I was blown away. I spent the summer working with his labor union, the Oil, Chemical, and Atomic Workers. And I studied one of the first toxic chemicals, trichloroethylene, which is a chlorinated hydrocarbon solvent that was causing hepatitis among these workers at a chemical factory that was run by Merck Pharmaceutical. That led to a study that was done by the very beginnings of the National Institute for Occupational Safety and Health, or NIOSH, which is a part of the Centers for Disease Control. And that eventually led to the phase out of trichloroethylene in favor of safer chemical solvents. So indeed, that was one of my first, I think, public health impacts as a medical student in the summer of 1976. I didn't realize it at the time. I was just a passionate, messianic, young medical student. I also spent the summer talking to workers at a labor union hall, which was an incredibly fulfilling experience and taught me that the people that know the most really about health and how to change the world were the workers themselves. So I haven't stopped listening to my patients and workers for the last 40 years. And what I'm going to show you is examples of that, and through case studies in which we can learn some medicine, but also learn about why it's important, A, to take an occupational history. I've been saying this for 40 years, just ask your patients what they do. All occupational disease is preventable, and connecting the dots. And I'll show you what I mean by connecting the dots. In other words, if you see something, say something. If you're in primary care or medicine or family medicine or neurology or whatever specialty, if you see somebody who has an occupational exposure and a health problem, either refer to occupational medicine, and we have an incredible faculty here, or talk to your local health department or the state agency, because where there's one case, there are going to be more. So I finished my fellowship here in 1984 in the specialty of occupational environmental medicine. I was across the street in Florida Parnassus in a little office building with a pager, and I get a call from a gastroenterology fellow in the ICU here who was taking care of a patient who was admitted to the ICU with gastrointestinal bleeding and hepatic failure. And he had gone to the waiting room where his wife was sitting, and his wife said, I think my husband was exposed to a toxic chemical. And I'll never forget the page I got when there were pagers back in the day. And my pager vibrates, and it's the gastroenterology fellow saying, I think there's a chemical involved here. And I think you're in occupational medicine, right? Has something to do with this. So I came over immediately, crossed the street right here, and I talked to the wife in the waiting room, and she said my husband had gone down into this underground concrete vault. He was a laborer. He was filling potholes for a living for a big company in San Francisco, but he had to go down into this underground concrete vault, which had an entry hatch. We call this a confined space in occupational medicine. Basically, one way in, one way out. This requires a very strict set of occupational standards, including supplied air, and you need to have a rescue plan in case somebody goes down in the bottom of that vault. He had none of that with his coworker. And he had applied this epoxy resin coating onto this big concrete water main. He used this chemical product called coppers, which was, if you look at the box here, and this is a picture of the box, had had 2 quarts that you mix together. And in general, if I see a chemical that's an epoxy that gets mixed together, the hair on the back of my neck starts to raise because it needs a lot of solvent. Because what's a solvent for? We all use a solvent every day if we paint. Solvent gets something active onto a coating and then evaporates, become a vapor, and leaves the coating behind. And in this case, it needed about 60% of a solvent. Unfortunately, this man in the ICU died of fulminant hepatic failure. And this is his liver. This is pathology from his liver. So this is a necrotic liver, incompatible with life, could be seen from a lot of causes, but in his case, it was the chemical involved. I went over to the library and I looked in the card catalog and right now I look on the internet, but I looked in the card catalog and I found papers that had reported this chemical that killed workers in confined spaces from one of these solvents, which is the 3rd one listed here, called 2-nitropropane. I then asked my faculty mentor, who was Dr. Charlie Hines, who was in the School of Pharmacy here at the time, and Charlie roughly said to me, "Oh, I remember this chemical. I had reported this 20 years ago in a journal article. And I had 5 cases like this." And that was my first moment. And I said, basically, WTF? Like, why is this still being used? Why is another worker dead when we knew about this in 1964? So I published these 2 cases, right? And here's really one of my first publications. Dr. Paul Blanc, who's here in the audience, Paul was a co-author with me. And this was close to 40 years, this was 40 years ago. And what happened here is that the coworker who survived, along with the surviving spouse, sued the chemical company for failure to warn that there was a chemical toxin here. And they won a few $1 million in a court settlement. And along with this paper, this chemical was removed forever from this product. And it's never reappeared since. And there's not been a single fatality because of this alert gastroenterologist who called me on the phone. And I'll never forget this because it illustrated for the first time the reason to take an occupational history and to realize that there could be more workers who were exposed. I'll never know how many lives I prevented, right? My field is one of those fields in which if something goes away and there's no one who gets sick or dies, I never know about it. I never know how many families are going. Basically, I'm working towards my extinction as a specialist. I don't think I'll ever become extinct. There are something like 300,000 chemicals in active use, okay? I'm humble enough to realize this is only one of them, okay? And there are many other hepatotoxic chemicals that are in existence. I mentioned trichloroethylene when I was a medical student, 2-nitropropane, gone. So my next case in which I had one of these opportune moments was a 24-year-old man who was referred to me by a community neurologist. And he had 8 months of tingling and numbness of his extremities, poor concentration, his memory was poor. He had been treated with high-dose steroids for what was considered to be an idiopathic polyneuropathy. He'd gained a tremendous amount of weight. He was feeling terrible from the steroids. The neurologist asked him what he did for a living. And he said he was a brake mechanic and he worked with chemicals. The neurologist had a synapse and said, I don't know anything about chemicals, but I'll refer him to Dr. Bob at UCSF. When he came to me for an examination, He had basically a neuropathy with decreased pen, light touch, decreased vibration sense, a broad-based gait. He couldn't feel anything up to his waist and up to his elbows. He had really severe peripheral neuropathy, had been documented by nerve conduction studies. And this is what he did. So he worked as a mechanic at a Ford dealership in San Jose. And his job, because the nature of work as an automobile mechanic, if you go into a dealership, is segmented. You got the brake guy, you got the transmission guy, you got the carburetor guy. That was in the days when there were carburetors, by the way. And so all he did every day was do brake jobs. And if I don't know anybody has done their own brakes. I used to do my own brakes when I was in college. And if you take a wheel off, it's covered with grease and black gunk, and you have to use a degreaser to clean off the rotors before you put the wheel on. And so that's what he was doing. And he was using 10 to 12 cans of a spray solvent every day. I said, bring the can in to see me when you come and see me. And this is an example of an ad, by the way, which drives me nuts when I see these ads. Like, is this guy wearing a respirator? Is he wearing any gloves? What the heck is he doing here using this can of solvent? And he brought in a can to me. And the can contained a solvent called N-hexane, which had been published in 1970 as the lead article in the New England Journal of Medicine, that is proven to cause peripheral neuropathy. It's one of about 7 or 8 common peripheral neurotoxins in the workplace. The mechanism is pretty well known. It causes damage to the peripheral myelin sheaths. It causes a classic stocking glove neuropathy. Thousands of cases reported originally in Italy in the Italian shoe industry. So if you bought imported shoes from Italy, the workers there were probably working in factories where they were cleaning off the glue with N-hexane. Later reported, by the way, among iPhone workers, manufacturing workers in China, because they were using N-hexane to clean the screens, your iPhone screens, before they would ship them back to the United States. Great degreasing agent. He was using it in a spray can, and the spray can was the one he was using on the right. And it's manufactured by a company called Berryman. It says non-chlorinated. I said, where'd you get this from? He said, an auto store. I left my office that day and I went to Cragen Auto on Van Ness and Cesar Chavez in San Francisco. And I found 6 different manufacturers with cans that contain N-hexane. I said, what are they doing in these cans? So I removed him from exposure. That was my very first thing. Tapered off his prednisone. And 2 years later, he's completely recovered. Very slow recovery, but a complete recovery. And he went back to work, not as a brake mechanic, by the way. He went onto the sales end of the auto industry. Published these cases along with several others that we found in California. And the key thing is, with my colleagues at the state health department, we decided to put out an alert. And the key thing in this alert that you might notice is that we named the products that contain N-hexane. It's on the right. It's a little hard to see here. But we found all these other products, and we sent this to 10,000 automobile repair shops in California and said, if you're using these, stop. And here's a number of other safer options that you can use. Within 6 months, all the manufacturers in the United States had removed N-hexane out of their brake cleaners. And instead of using the product on the right, they sell the product on the left. And it does not contain N-hexane evermore. So now we can go to Cragen Auto and N-hexane is gone. So again, a great example of medicine, alertness, combined with a publication, combined with outreach, publicity. Manufacturers worry that if they continue to sell this product, it might affect their bottom line, right? Because what are the manufacturers worried about? This led to a number of other really great consequences. The graduate student, Mike Wilson, did his thesis, his doctoral dissertation on Berkeley on this outbreak. Mike became one of the authors and the policy impacts of what we call the green chemistry law, which we passed in California. It was signed by the governor. And that is one of the only states that allows us to list product chemical combinations, consumer products that also affect workers in the workplace, and eventually ban them from sale in California. And it's very difficult on a national level, if not nearly impossible, to ban a chemical from use. In fact, we don't have any international trade laws or regulations that prevent the import of toxic chemicals globally. One of the fun things that I always have thought about doing is going onto Alibaba. Everybody, Alibaba is like the Google of China. I can buy pure benzene, which is one of the most toxic chemicals, causes acute leukemia. It's been known for 100 years. I can buy pure benzene and import them to my house on Dolores Street in San Francisco. And I can set up a business manufacturing some product using pure benzene. I would like to do that, except I have a minimum order of 5,000 barrels. So that's my only problem that prevents me from proving how dysregulated the system of global trade has become. I'm going to show you this at the end, the last example. So the next, and I'm taking this chronologically over time, by the way, is this. And this is artificial butter flavor. Back in the 1920s and 1930s, product chemists worked by the thousands, mostly in the New York, New Jersey area, to develop perfumes and scents for women in the emerging working and middle-class market, which include my own mother, by the way, who loved Estee Lauder. For some reason, she loved that perfume scent. And if I had a birthday present, I could always score with Estee Lauder. Who knows what the chemical was that created that scent that my mother loved? But one of them they created was this chemical called diacetyl, which if you swallow it, if you taste it, zaps your taste bud in the exact place and tricks your mind into thinking that it tastes just like butter. But it's an artificial chemical. I don't know how the chemistry works, honestly, to make your taste bud, but there's a million chemicals, thousands of chemicals that trick your taste buds and your olfactory nerve into thinking that this is actually, something smells like a rose, but it's a chemical that smells like a rose. An alert doctor in Missouri called Alan Parmet saw a half a dozen cases of the most severe lung disease he had ever seen, bronchiolitis obliterans, a progressive, irreversible airways disease that early on looks like and is often diagnosed as asthma, but later becomes very progressive and irreversible. And they had all worked at a popcorn plant in which they were adding this artificial butter flavor to microwave popcorn. Before 2007, if you went and bought microwave popcorn and popped it at home or in the workplace, and you opened up the microwave and you get this, I kind of always thought it was a sickening smell, but an artificial butter smell, that was diacetyl. The workers in these plants would add bags and vats of diacetyl to the microwave popcorn bag. And Dr. Parmet reported this to the Missouri Health Department, who later reported it to NIOSH, remember that research agency, and they came out and did these studies of workers with bronchiolitis obliterans in microwave popcorn plants. They found 8 workers with severe lung disease, 4 of which were waiting for a lung transplant. You can see vats here on the left of the liquid artificial butter flavor. The conditions in these plants were miserable. That's a non-technical occupational medicine term, exposure were really high when they measured it. And they published a New England Journal paper in 2002. And they called this popcorn lung. And it was known as popcorn lung for several years. They showed a really nice dose response curve when they found workers by exposure. The greater the exposure, the greater loss of FEV1 in these popcorn plants. And again, they reported it at a microwave popcorn plant, but it was a kind of an obscure, the way it was presented, because it was popcorn lung. Well, people thought, well, you could only get it from somehow connected to popcorn. And who eats? I mean, what is that, popcorn? Until a case came to my attention, reported by an alert pulmonary doctor, Phil Harbour, at UCLA. And Dr. Harbour, Phil, saw two workers. This was the index case in California, and she was 40 years old, and she had mixed dry powder with diacetyl for 5 years, and she had an FEV1 of about half a liter, irreversible, and she had a high-resolution CT with ground glass opacities, which is one of the hallmarks of bronchiolitis obliterans. And Dr. Harbour, Phil, called me up and said, Bob, I got 2 cases of bronchiolitis obliterans from the same company. Well, as an occupational medicine physician, that's an outbreak, okay? That's 2 cases. You might not consider it an outbreak, but where there are 2 cases, there may be dozens or not hundreds more in my field. So what did I do? I posted them on the internet of the State Health Department website. I didn't publish them. I didn't wait. In this case, I didn't put these in a peer-reviewed journal as a case report. I published it in these like dense two cases, and you can see there's a couple of colleagues down in Southern California, Dr. Arthur Geld and Dr. Phil Harbour, who had called me up. But the key thing that happened here is that a Pulitzer Prize-winning reporter got a hold of this, Andrew Snyder, who published this in the Baltimore Sun, which was a really good publication, by the way, with investigative journalists. And it was picked up by the Sacramento Bee. And it basically said that we were going to have a crisis on our hands from bronchiolitis obliterans. And it opened up a whole series of investigations by researchers and state public health authorities. And I walk in when I got these 2 cases, and I posted this on the internet to my colleague, Julia Quint, who I work with the State Health Department. And I said, you know, Julia, everybody knows this is popcorn lung. And Julia said, what's the cause? What's the chemical? I said, diacetyl. She said, okay, we're going to call this is caused by diacetyl, this chemical. And that led to all sorts of policy changes by just shifting the description from popcorn lung to the name of the chemical, because there are companies that make diacetyl. Companies don't make popcorn lung. There are people and companies that make diacetyl. About 20 of them around the United States, ranging from big and small manufacturers. And so we put out this hazard alert. We notified all the companies. I hired Barbara Burgle on our nursing faculty. I hired Max Burgle to spend the summer going through telephone books and calling all the companies that he could find that he thought manufactured diacetyl. And he called up and he talked to the receptionist at the front desk. And he said, do you use diacetyl? And the receptionist would call out, hey, do you use diacetyl in the back, right? And we found 28 companies that way. It was ridiculous that we had to use the phone book because we didn't have a system, because companies don't have to register their use of this toxic chemical. That led to a meeting with Bill Monning, who is the Senate chair at that time in Sacramento. And we went into Bill's office with a phone book. Literally, I went into his office with a phone book. And I said, Billy, do you realize that we don't have a system of tracking chemicals? And he said, you're kidding me. Policy lesson there, parentheses, make it simple. To legislature. It took a phone book to get him to write legislation, which the governor signed, which now gives the health department authority to ask chemicals what chemicals they're using in the supply chain. Only law in the country that does that. And colleagues published this. We eventually published a case, 28 companies that were studied who used diacetyl. There was a petition for an emergency standard among our OSHA Standards Board. It took 4 years to get that petition through, faster than I would have liked. But in my world of occupational medicine, that's lightning speed. At a federal level, that works at glacier speed. Although glaciers are melting more rapidly now, so maybe I can't say that, unfortunately. But it took us 4 years, and we got the first and only emergency standard that prohibits the use of diacetyl in anything but enclosed systems. And those manufacturers, rather than going to the expense of enclosing all their diacetyl, have gone to alternatives. And so I've seen no other cases of bronchiolitis obliterans in California. Success, gone. We've seen a few nationwide. This case was brought to my attention by a reporter who was covering the fracking boom during the Obama years. We rapidly expanded oil and gas development in the American West. It's one of the reasons why we're the largest oil and gas producer, by the way, in the world right now, and why we can probably withstand what's happening in Iran, by the way. Dustin Bergsang was a 22-year-old who was working up at an oil and gas site in North Dakota. And his job was to open up gas tanks, climb up, open up the hatch, put a stick down and measure the oil and gas level in these giant oil tanks. Sounds crazy that you would open up an oil tank hatch and measure it with a stick. And he died on a frigid day in January in North Dakota. This is what it looked like. His autopsy showed high levels of alkanes in his blood. You can see there's butane, isobutane, some benzene. So he asphyxiated on top of the tank hatch and was found dead at 2 a.m. The coroner thought he was huffing, that he was intentionally getting high in the middle of the winter at 2 a.m. in the morning to test the oil level. Because the coroner the coroner in that case in North Dakota was seeing a lot of huffing cases that was causing death. So his first thought was this was not occupational. Then another case, same thing happened in Lambert, Montana, and that's the well site. And he also had butane and protein in his blood. So now there are 2 cases. Epidemic time, outbreak time in occupational medicine. We put together a dozen other cases and published this in the MMWR. Again, get the word out immediately with co-authors from OSHA and NIOSH. And we called attention to this. We made a video with the oil and gas industry that was directed to all these oil and gas workers who were dispersed all over the American West. And this is probably one of the things I'm most obscurely proud of. What happened was, because we published these cases, the Bureau of Land Management, the BLM, who regulates the mineral rights to oil and gas wells in the United States, most of the sites are owned by the federal government and they're leased to oil and gas companies to take the oil out of the ground. They were requiring an accurate measure of oil and gas in these big tanks because they're collecting royalties. And they thought the most accurate way to get the exact measurement to collect the most money for the taxpayer was to measure it by hand. And we convinced them to do it remotely, to allow remote tank gauging. Because I said, look, why do you have to measure this by hand? There's technology to figure out exactly how much oil and gas is in that tank. So they passed this regulation, and now there's no more manual tank gauging. It's done automatically, no more deaths. Okay, couple more cases. Now, fast forward, now we're in 2000s. We're in 2012. And I go into Home Depot. Everybody's probably in this audience has been at the Home Depot. And I go to the paint aisle, and iHeight is America's favorite paint stripper that you use to put on windowsills, doors, whatever, to remove paint. And it contains methylene chloride. If you go down, this is a safety data sheet, and you can see here under composition information on ingredients, 60 to 100% methylene chloride. Mixed with the next ingredient is methanol. These safety data sheets, by the way, drive me nuts because you can see that the concentration is 60 to 100%. Well, what does that mean? The manufacturer of this product, it's WM Bar, the largest methylene chloride manufacturer, knows exactly how much methylene chloride is in there. The reason they give the range is to keep it a trade secret. Okay, well, it shouldn't be a trade secret from the workers that are using methylene chloride. Colleagues in Michigan in 2012 connect the dots. Remember that first slide said connect the dots? He connects the dots, they connect the dots, they find that there are 13 deaths among bathtub refinishers who are using methylene chloride. Why is methylene chloride used in a bathtub? Well, as our infrastructure ages and our bathtubs get older, particularly in older buildings and rental apartments, it's cheaper to strip the coating off a bathtub, recoat it, than it is to take the bathtub out. In fact, it's about $500 versus $3,000. So what are people doing? They're paying $500 to get their bathtubs recoated, and up springs a proliferation of small companies that are using methylene chloride to strip bathtubs. And what happens is that you put the methylene chloride at the bottom of the bathtub, you let it soak into the coating, you walk away and you come back in a half hour, and then you take a scraper and you lean over and you die of methylene chloride asphyxiation because it's accumulated in the bathtub. And this happened to 13 workers over about a decade. But it wasn't until Ken Rosenman, an occupational doctor in Michigan, connected the dots. He happened to see by reading these fatalities, oh, a bunch of these are happening. At the same time, I'm investigating methylene chloride deaths in California. And I had investigated this death from methylene chloride, it's a little hard to see, at Vista Paints. So when we go out and buy paints in the store, probably most of them are made by a generic manufacturer who's putting labels like Sherwin-Williams on the can, but they're all made from the same place. In this case, it was a big paint formulator called Vista Paints. This is one of our occupational medicine residents who's going and looking down at a paint vat that's with a mixer, a propeller blade at the bottom, and you can see all this accumulated paint. They're taking methylene chloride, they're applying it down there, they're scraping it away, and a worker was overcome and died at the bottom of this vat. And you can see in his toxicology finding that dichloromethylene, which is methylene chloride, was 220 milligrams per milliliter. It's consistent with the MMWR fatalities in the Kane series. There's no question that he had died of methylene chloride poisoning down there. Turns out that methylene chloride was one of the first chemicals studied by NIOSH in the mid-1970s. And they had put a door in a chamber and applied a pint of methylene chloride and let it evaporate after half hour. They came in the chamber, they measured the methylene chloride levels, and it was immediately dangerous to life and health. If you went into that chamber, you would die. And so they called attention to this in the mid-1970s. Then I get another fatality in this bathtub, and this was in a rental unit, apartment complex in Los Angeles, and here's the bathroom with one small window no ventilation, right? Because a lot of bathrooms don't have, because they're built before the code, they don't have exhaust fans. And that worker went in and died of the same poisoning, methylene chloride. We start working on a case series when Wendy Hartley's son died. And that's Kevin Hartley in the picture. And he had worked for his stepfather, and he applied this chemical coating for his stepfather's bathtub refinishing business, and he dies. And his mom, Wendy Hartley, realizes that her son's death was entirely preventable, and begins to publicize and campaign. And along with two other families, the Wynn family, Drew Wynn died in a locker in South Carolina, where he was cold brewing beer, and he had purchased a locker secondhand and finishing the floor of the cold storage locker. And Joshua Atkins, who was 28 years old and an avid mountain biker and climber, and he was refinishing the forks on his mountain bike at home in the bathroom when his mom came and discovered him dead. These families collectively lobbied the first Trump administration, including Senator Lindsey Graham, who took this case up and brought it directly to one of President Trump's chiefs of staff. And along with this reporter, Anna Werner, for CBS Morning News, who ran a series of stories, very impactful. I'm interviewed in this way. And this article that was published in the New England Journal by Annie Wong, who was a UCSF med student. Annie put together a terrific case series documenting 80 cases of methylene chloride. So of this data and legislatively at the White House led to a ban on consumables, methylene chloride, in 2019. The day that this was banned, I went back to Home Depot and I looked on the shelf, and WN Bar had a can that looked exactly the same, but it contained benzyl alcohol, which is a safer substitute, which was a lesson to me that the manufacturers saw this coming, because they said, how come there's a safer substitute the day it's banned? How's that possible? They had it in their back pocket for years and kept on selling methylene chloride for as long as they could. And in 2024, it was banned from almost all commercial uses by the US EPA. It was one of the last bans to get under the wire, honestly, before this last election, under what's called the Toxic Substances Control Act. Okay, so I'm going to end here. So we're back to Home Depot. Seem to be picking on Home Depot these days, I'm sorry. Forgive me. Back to Home Depot. In the back of Home Depot, if you're looking for a kitchen countertop, you're going to see this. And you're going to see products that are made of artificial stone that's composed of 95% silica flour, the most finely ground silica particles that there is, mixed with a toxic chemical called polyester resin that's been baked in a hot oven under vacuum, mixed with all sorts of cool looking pigments and cooled off, and then is sold globally around the world, and now accounts for about 70 to 80% of the countertops that we buy if we're searching for a countertop. We used to be looking at marble and granite. Before marble and granite, we had tile. Before tile, we had wood. Before wood, I think we had things like linoleum and formica. But now we have artificial stone. And the problem is that when that artificial stone, when we buy this nice looking and well-using product, it's fabricated in shops that look like this. And here's a worker who's polishing and cutting, grinding the countertop to make the hole for your sink. And he's covered with really fine silica dust. He's using a useless respirator It's not protective enough. When he takes that respirator off, the giant clouds of dust are still in the air. When he sweeps, the dust gets re-entrained, gets back into the air. And this was first reported, again, Dr. Paul Blanc, who's here. Paul, you were a co-author on this paper in 2012 from Israel. This is one of the first case series. And this was happening because one of the first companies to produce this product was Caesarstone. So some of us may know this product just by the generic name Caesarstone. It's kind of like the Kleenex of countertops. These were being fabricated in small shops in Israel and were being sold to the commercial and consumer market in Israel. And the doctors at the medical center here began to see severe cases of progressive massive fibrosis requiring lung transplant. You can see the first case was actually in 1997. And the case, this appeared in Chest in 2012, a case series of 25. So this was our first alert that this was causing silicosis. And by the by, Paul probably can remember this, but the original articles called this Caesarstone silicosis. And Caesarstone threatened to sue Chest for using the word Caesarstone. And they retracted the word Caesarstone, and it was labeled artificial stone workers, okay? I often wonder now what would have happened if this was called Caesarstone silicosis. So I read that paper. I posted a blog, just a posting on the NIOSH website about possible dangers here in the United States. Gary Friedman, a pulmonary doctor in Houston, actually responded to the blog. I used to think that blogs didn't matter, but now I think blogs can make a difference, particularly now, social media. But Gary responded saying, oh, I have a case. So we published the first case of artificial stone silicosis in February 2015. That was the case number 1 in the United States. It was at a fabrication shop owned by Cosentino, which is the world's largest global manufacturer of artificial stone. In California, we then discovered our first case in January of 2019. And that was from a hospital discharge record that we found. And it was a man in his early 30s. And when I saw that case in our hospital discharge record, there was no other cause that I could think of silicosis in a man in his early 30s, because simple silicosis, which is the classic form that we see, is typically diagnosed in someone in their 50s and 60s, and they can often survive. With simple silicosis, it doesn't become progressive. It doesn't cause you to be admitted and die when you're in your early 30s. And he died of accelerated silicosis, which is a form basically that's relatively rare in this country. It was seen back in the 1930s in a very infamous episode at Hawk's Nest at Gawley Bridge, when workers were digging a water tunnel through silica-containing stone. And we published this in 2019 along with colleagues from 3 other states, a total of 18 cases, including 4 others from this same shop where these 2 index cases that we found were diagnosed. Then the COVID pandemic hit, and our work sort of came to a halt from a research and public health investigation point of view. But home renovations and home construction did not come to a halt. In fact, it was as good as ever. I don't know if you remember during the pandemic that we were at home and we had some disposable income, presumably, I don't know. Home renovations took off during the pandemic. And Dr. Jane Fazio, who's a pulmonary physician at UCLA, came to a poster that we had at a Thoracic Society meeting, and Dr. Fazio said, I have 25 cases in my practice at UCLA, all of you, the county hospital there. And that's another classic example of an alert clinician, because I think if Dr. Fazio had not come to Dr. Gandhi on our pulmonary faculty and myself and said, Bob, what do I do? How do I stop this? I'm feeling terrible. I'm just seeing these cases. I don't think we would have made this progress that we have. She published these, by the way. That was in July of 2023, when we had 52 cases in California. We'd gone from 2 to 52. And if you look at the epi curve here, and I compare the CHEST paper from 2012 to the Fazio paper in 2023, it's creepily the same. And I feel really quite terrible, actually, about this 2023, because this is entirely preventable. And I think we saw it coming. I certainly saw it coming and was not able to stop it. After this was published, our OSHA Standards Board that passes regulations that regulate silica dust exposure in the workplace passed an emergency standard. And one of the patients who was on the transplant list, unfortunately, he never made it to a transplant. He testified and probably was the singular reason why our OSHA board voted in favor of an emergency standard, honestly. There wasn't a dry eye in the house, along with Jane and her data. Well, I wish I could tell you that that's the end of the story after we passed an emergency standard about these shops. We're now up to 512, and this is as of February 12th, 2026. So of today, it's probably about 520, because we're seeing 1 or 2 cases increase a week. This is a dashboard published by my colleagues at the California Department of Public Health. We're at 29 deaths and close to 50 lung transplants. So this is a really terrible epidemic. Australia became the first country in the world to ban the use of this high silica containing countertop product. They did this in January of 2025. And I went to Australia in November, 3 months ago, on a personal fact-finding expedition to find out what happened when Australia implemented the B word, the ban word. Australia does things that we don't do in the United States. Like if they have a mass shooting, they outlaw semi-automatic weapons within a couple of months. They passed the first law restricting social media to kids less than 16 years of age. They do things like this in Australia, and they pass things like this. And what I found is that I went into Bunnings, which is the Home Depot of Australia. I found a range of really nice looking countertops that are all zero silica, all zero crystalline silica in Bunnings. And when I talked to the sales clerk at Bunnings in Melbourne, and I told him why I was there, he said, "Why don't you do this in the United States?" Which led to a whole interesting conversation about the political differences between this country and theirs. In December of 2015, our medical organization of occupational professionals, called the Western Occupational and Environmental Medical Association, has petitioned our OSHA board to prohibit, to phase out the use of high silica containing artificial stone. And that board is having a series of meetings once a month. And when Gina said, "You probably will find me at these meetings," you will find me in Palm Springs on March 19th, when we formally present this petition to this 5-person board. And I'm hoping by May, they will accept this petition and we'll have regulations that in short order will phase out. And what we will have as consumers when we go into Home Depot, what we see in Bunnings, which is countertops made from crushed glass, amorphous silica, which is a different form of silica. Is it completely non-toxic? Probably not. But is it much less toxic than crystalline silica? Yes. So I'm hoping I come back to you in 2 years and we will be going into Home Depot and I will no longer be seeing silica that kills workers. Thank you.
Hooray, thank you so much. That is so inspiring. And we have just time for maybe a couple of questions. Don't see any hands jumping. Oh yeah, I do. Okay. First question, down there.
So the popcorn one that also came up with the vaping, right?
Yes.
Like artificial, so it says has there been regulation there around?
I was just remembering the headlines for the popcorn lung and the like kids who are vaping, kind of buying off market the liquids, and wondering what the regulation has been there.
So there are no formal regulations to prohibit artificial butter flavor, but vaping products did contain diacetyl. And one of my fun projects was going around to vape stores and asking for products that contain diacetyl, because I pretended I was going to vape artificial butter products. And they were sold all around the Bay Area, by the way. They've been phased out. And I think it's because of liability problems, but there are no regulations. There are no formal regulations that require that artificial butter flavor vape products can be off the market. But I'm not finding them any longer, thank goodness. It was one of the hypotheses, right? You remember all the vape deaths? One of the hypotheses was that it was from diacetyl.
So I was really struck by the focus on kind of other countries and international contributions to this. And given that we have a very changing political and funding landscape, I'm just wondering, has there been sort of a thought to having more formal relationships or associations with other countries? Has there been useful research that's funded by these other countries that have been brought before our legislatures, to help make some of these decisions?
Yeah, it's a great question, Monica. So there are some international collaborations across countries and research. Not enough. I think we absolutely need more of that. And the major organization that's kind of the umbrella was the World Health Organization. And one of the things that's worrying me is what our contribution and our thinking is about World Health Organization at the moment, which is why it's so critical. I have to say, when I came back from Australia in November, and I thought, I can see the path to stop the silicosis epidemic and safer alternatives. And I went to that board that we petitioned in December, and I told them all of this. And I said, Australia is like, been there, done that. Just take a lesson from our international colleagues. I was struck by how little we actually cared as a society, as a board, about what happens in other countries. It's interesting. I pointed out that Australia is not a tiny little obscure island. It's actually a really big country that's very advanced, that has 60 million people in it. But it's I don't know, it was very interesting. I thought, well, just believe me, I was there. But and I have all this data, and I showed them data. It's interesting that we somehow seem to only want often to listen to our own local research, and what we learn from other countries doesn't seem to resonate. That's a whole political, social conversation.
So in regards to what Australia is now offering, and you're talking about using the amorphous silica, does Australia have one of those amorphous silica slab countertop types? And if so, have they had any incidents of silicosis? Because my concern now is that, yes, the sharp crystal structure is dangerous, but what about if the ground heated polyester epoxy is also part of the problem, or is the actual problem?
Again, a great question. How to proceed scientifically with policy in the face of uncertainty, because there's relatively little data on the toxicology of amorphous of these alternatives. So I thought about, is this what I would call whack-a-mole, right? We go and prohibit one product and substitute it with an amorphous glass, a recycled product, about which I wish I knew a great deal more. It's frustrating because, to me, manufacturers are responsible for doing these toxicology studies, right? They need to be responsible for showing these products are safe for consumers or workers before they can sell it on the market. There's no requirement that that be done. So there's very little studies done on amorphous silica, John. When I went to Australia, I asked all my colleagues, what do you think? I've asked every pulmonary expert, and the general consensus is it's probably safer. You know, it's the probably, right? Okay, is it absolutely safe? No. I decided to look at it as harm reduction in the same public health paradigm. And so I put all my cards on the table on amorphous, realizing that we need to do more research. Maybe we put this product out on the market. Maybe there's some safety concern to these fabrication workers. We can't let our guard down. Those fabrication workers still need to protect themselves against silica dust. So they still need to adhere to that same OSHA standard. But what to do in the face of scientific uncertainty, felt I'm going to err on the side of safer, not absolutely safe, for lack of research.
Thank you so much. Really appreciate it. Thanks again to Bob Harrison for a great talk.